My name is Martha. As a healthcare worker, I'm proud of the work I do. Recently, I increased my knowledge of HIV prevention with the introduction of PrEP. First, I needed to learn everything about PrEP, including understanding the national guidelines. PrEP is a daily pill for HIV-negative people who are at a substantial risk for contracting HIV. Once I knew what PrEP was, I felt confident to counsel people on using it. A 22-year-old woman came in for her regular supply of contraceptive pills. I took the opportunity to ask her some questions about her sexual history. I couldn't show how I felt inside because I can only help my clients if I know the truth about their sexual activities. And they will only speak freely if they feel comfortable, knowing they can rely on me to be confidential. She left it to her boyfriends to decide if they used condoms or not. Because she relied on some of them financially, she didn't feel she could ask. I told her about PrEP, a pill for HIV-negative people, which gives over 90% protection against HIV. She liked the idea that she could be in control of her sexual health. She was nervous at first about having an HIV test, which she needed to ensure she was negative. I assured her that it was best to know her status and that there are many options to prevent HIV transmission. She was reassured. Now she's on PrEP and has the control of her sexual health in her hands, not her partner's. Her fear of being judged transformed into confidence and trust in me. Imagine, I changed the course of a young woman's life. I feel so proud. At first, my co-workers were worried that giving PrEP would lead to people having sex with more sexual partners. But I explained the problem isn't that people are having sex. The problem is that people are having unprotected sex. In the year 2019, Zambia reported 43,000 new HIV infections. As healthcare workers, our priority should be on doing what we can to stop the spread of HIV. That's our job. I met a serodiscordant couple next. The man was HIV positive and the woman was HIV negative. He was on ART, but not yet virally suppressed. But he seemed reluctant for his partner to go on PrEP. I fully explained the benefits of PrEP, including their ability to be able to try to have children without worrying about infecting his partner. They agreed to give it a go. PrEP is really working well for them. Sometimes people just need someone who they can trust to talk about their options. I see my clients on regular visits to make sure they are adhering to PrEP and to discuss how they are doing to see if there's any other advice and support I can give. PrEP is only for their season of risk, so it's important to check their risk assessment regularly. Connecting with young people can be a challenge, but when you are open and friendly, and when they see that you really are listening and understand their concerns, fears and hopes, then they do open up. I remember one man who came in just for condoms. He didn't want to talk very much, but I persisted with a warm welcome and a friendly chat about life. He soon felt comfortable to talk. He was in a relationship, but sometimes had casual sex with other women, so he needed condoms. Although he did try to use condoms all the time, sometimes they didn't have any, but that wouldn't stop him from having sex. I asked him if he knew the sexual partner of his sexual partners. He didn't. I told him that is why it's always best to be double protected. Protected from STIs, including HIV, and protected from unintended pregnancies. He was clearly at high risk. And once he heard about PrEP, he realized he needed PrEP as well as the condoms. Everyone has the right to protect themselves against HIV. It's our job as healthcare workers to explain what their choices are without judgment. I care about what is happening in my community, and I'm blessed to be in a position to help. The trust and respect that I get in return from my community is so rewarding. I have built this trust and respect by providing a welcoming atmosphere that allows people to discuss their concerns openly, knowing that it will be just between them and I. Next time you have a client who is at high risk of HIV, remember to consider them for PrEP as a safe and effective method of protection. They must use it correctly, and they should use condoms to prevent against unintended pregnancy and other STIs as well. Let us be part of Zambia Ending AIDS. We are the difference makers.